Hi, welcome to Senior Moments Successful Aging. I'm your host, Mary Beals-Luedtka. I'm the director for the Area Agency on Aging at NACOG, and you can reach us toll-free at 877-521-3500. If you have questions about aging or questions about our show today, please give us a call, or you can call our co-sponsor at the Division of Lifelong Learning, Yavapai College. We have our producer, Danny Tomerlin, and you can call her at 717-7755. Again, welcome to Senior Moment Successful Aging. Today our guest is Beth Brehio. Hi, Beth.
Hi, Mary.
Welcome.
Thanks.
It's not like we don't know each other.
Right,
So
exactly.
Beth is on my staff and has a very important position really with us, because as we move forward, health and wellness is a huge part of what we're doing at the Area Agency on Aging. But let's step back for a minute first and talk a little bit about your background. Where did you grow up?
I grew up in Los Angeles.
An
Los
LA
Angeles
girl.
proper, when it was, you could still drive with ease.
I didn't know there was an LA
there was a
proper.
time.
There was a time. And so when did you come to Arizona?
25 years ago, in 1993, yeah.
So then you
Been here
qualify
quite a
almost
while.
for a pioneer then.
Yeah, honorary.
Honorary, me too.
Yeah.
I came in, so I was in 84.
Uh-huh.
So how long have you been in Prescott area?
All of those 25
all of
years,
those
same
years.
house, same place, nothing has changed.
Excellent. And you have quite a background in health and wellness.
I do.
You know, how did you get started in that?
Well, I'd always been interested in physical activity, fitness, nutrition personally, but it never occurred to me to do it as a career. And so I had a work-related injury that enabled me to go to school. So I met with a career counselor several times, and we found that Central Arizona College had a dietetics program that worked with Yavapai College. And so I became a dietetic technician registered, which is a fancy way of saying I'm an assistant to registered dietitians. I can stand alone with public health, but when it comes to clinical practice, I need to be overseen by a dietitian.
Kind of like a doctor and a nurse.
Exactly, or a physician's assistant.
Right,
yeah,
right, the
to a
same
doctor.
thing.
Yeah, exactly.
So now you worked for 14 years at the VA.
I did.
You know, what
yeah.
did you do there?
Well, I did my internship in the dietetics program with a proctor that worked at the VA, and I did my internship while I was a food service worker, which was, I think it's really nice to be able to start at the beginning. But I did my internship simultaneously, and when I completed my program, they placed me in a clinical position.
Nice.
And so I worked with the dietitians, and what happened over time was I had a little flexi time in my schedule. So I asked my supervisor, can I do a brown bag lunch wellness program for the employees? And she said yes. And then I said, can I teach yoga? And she said yes. And I gradually migrated into a full-time wellness coordinator there.
Nice. So you were there 14 years, and how long have you been at the Area Agency on Aging?
2.5 years now.
2.5 years
Yeah.
already?
Poof.
Yeah. My mom says it's like smoke through the keyhole. That's
Yeah,
time.
right. Scary.
Time. And so your position at the Area Agency on Aging is definitely health and wellness.
Oh, absolutely. Yeah.
And we're really excited about, because in looking at our history of 40 years, that's a fairly new program.
Yeah, absolutely.
It really
yeah.
is. And looking at what we do to help people stay healthy. So
Sure.
what are some of the programs that you administer?
We administer the Stanford University Chronic Disease Self-Management Program and offshoots of that, which are chronic pain self-management and then diabetes self-management. And our most popular program addressing fall prevention is a matter of balance. And I honestly have a difficult time doing enough of those to accommodate everybody that's interested. And what's important to know about that is people are aware of the risks, so they are advocating for themselves, and they're filling these workshops.
I know that we also have another staff person that works with you, Susan Hunter.
Yeah.
And I fell in May, right. and she right away she goes, okay, what did you do wrong? What were the factors that led to your fall? I'm like, oh my gosh.
Right.
She goes, you need to go to Matter of Balance. And we go, dear. So I haven't sat through a class yet, but I understand it's very participant driven.
Absolutely, yeah. What they bring to the table from their years of experience, whether they've fallen or not, is really what makes the class so rich.
Yeah, and
Yeah.
so, and I also realize now that I'm over 60, it hurts a lot more to fall. And so I now realize why, as people get elderly, that they're more cautious in walking. We're thinking, oh, that
Sure.
lady's going so slow, but man, it hurts when you fall. And it takes longer to recover when you fall.
Yeah, well, there's an interesting thing now that you brought up the correlation with being older and falling, because falling is not a natural part of aging. What falling is a natural part of inactivity and chronic conditions and the multiple medications that you have to use to manage chronic conditions. So really, that's where the health and wellness prevention really comes into play. It's preventing those chronic diseases that lead to other types of risks.
Well, that makes sense. Oh, and also, wearing the right shoes and paying attention.
Oh, well, yeah, those are, yeah. And sometimes, I think those seem so obvious, but they're not always. That's, like you were saying, people bring their own experience to the table. So somebody in the group may say, oh, I had these types of shoes and they were non-slip, but you know what? I stuck to the floor and I hurt myself anyway because my body propelled forward. So somebody else can learn from that.
Yeah, somebody else can learn from that. So what, you mentioned your personal want about health and wellness, but what drew you to older Americans, older Arizonans, working with that population?
Well, the VA is by and large older Americans, and they're a lively bunch of characters over there. And so I learned my craft with, what I've learned from group teaching is that there's always representation of several types of personalities. And you'll meet them in the first hour of your program. Who's the one that knows everything? Who's the one that's funny? Who's the one that, that can rally the group? Yeah, it's really interesting, yeah.
And who's the one you have to draw out?
Yes, yeah, definitely. But that idea of other people that are more outgoing, having the courage to say certain things, gives those that may not have that courage to say something. I don't. If you've ever had the experience where you have some sort of internal feeling, but you can't articulate it, but you hear somebody else say exactly what you feel, and then you relate.
It's also like watching a movie. Sometimes you have an emotion that you haven't touched into, and that movie touches it, and you're like, oh.
Yeah, exactly, right.
And then it brings you back into it. So most of the classes that you do for the area agency and aging are older persons that come to it.
Yeah, 60 and over, but people with disabilities as well.
Okay.
Yeah, because I think a lot of people don't realize you can't fall out of a wheelchair. It seems like a safe place to be, but accidents happen there as well.
That's true. And especially when there's uneven pavement, that kind of thing.
Yeah.
So what's really different about, I want to go through each of the programs so our viewers can kind of understand what they do, because it can be intimidating. It is, chronic disease management and this management, that management, and you're thinking, wait a minute, I can't manage my daily calendar, let alone my own health. And I think there's really more and more need for us to be aware of our own health and manage it. So,
I think too it's important to have a definition of what chronic condition means. That's sort of a gray area. Chronic condition can be anything from depression in a mental health capacity, arthritis, diabetes, heart disease, Parkinson's, knee replacement, something that you're going to have to deal with over time.
So when you think chronic disease, it's not necessarily something catastrophic. It is something that we live with, and there's a lot of data about us that are 65 and over. Most of us have at least one or two. Is that?
Yeah, it's likely.
Yeah.
If we look at statistics, that's what it'll show you.
And I have a touch of arthritis, so I guess I have a chronic disease.
But it will also show you that people that don't have chronic disease at the same age, it will show you, what they did. These are the people that have engaged in fitness, ate well over the years. They're the ones that are most likely to not have that condition.
Yeah, so. And nutrition is such a huge piece.
Oh, absolutely.
That, and do you talk about nutrition during the classes?
Yeah, we touch on it briefly, not in depth, but what usually happens is the interest sparks, and then the participants go on to greater interest in it.
So it's the participants that drive, but it is evidence-based. What does that mean when you say evidence-based?
Evidence-based means that a large body of research has been conducted through huge populations, crossing cultures, races, and it's indicated to make a positive difference as a result of participation.
So, and you're a master trainer.
Yes.
So, and what does that mean?
That I'm a master trainer for matter of
Matter
balance.
balance,
Right.
right.
What does that mean? That means I can teach people to be coaches. Now, originally, Matter of Balance was created at Boston University at the Roybal Center, and so the creators were physical therapists, doctors, medical credentialed people, and they found that that would be a costly way
Yeah.
to try to spread this program. So they made a lay leader model, and that means anybody can do it. You don't have to have a background in healthcare or anything. Anybody with an interest in wanting to help their peers.
And that's really what's helped spread the program. And then you as the master trainer check on them and help them.
Absolutely, yeah, it's an oversight. Yeah,
Right.
all of the thing about evidence-based programs is fidelity is the key. And what that means is when I agreed to carry this program into the community, I signed something that said I would teach it verbatim, exactly, because that's how it was proven to work. Yeah,
So-
if I start putting my personal, you can bring your personality into it, but your personal beliefs that may be different from the program, it would break the program down.
And then it wouldn't be evidence-based anymore.
Absolutely.
And then you're also, we also have chronic disease management, self-management.
Self-management.
And that, like you said, was any kind of chronic disease. And then there's a diabetes program now.
And by the way, even if you don't have the chronic condition, if you are,
That's a good point.
if you have a spouse that has a chronic condition or any kind of family member or a friend, you're welcome to that group too, with them or by yourself.
That's a great idea. We have so many caregivers in this community.
Right, yeah.
And they need all the information they can get. And then we also have the diabetes right now, and that's
Sure.
2 years old, I think, is all we've been doing
Yeah,
now.
it's pretty young, and I've not been trained in that
Okay.
yet. I have chronic pain and the generic one, which is chronic disease.
Well, chronic pain, I can remember 15 years ago at coalitions in the Prescott area talking about we need more pain management. We need that. So, could you tell me a little bit more about that program?
Yeah, and I think it's especially important now with the prevalence of abuse of pain medications. Yeah, so what it does is it offers you other avenues of managing pain rather than just going directly to that and then needing more and more and more, so it gives you different tools. And so I can talk about chronic pain, but really chronic pain and the chronic disease self-management program are so similar in that they don't really focus on what's your pain, tell me about it, how does it work, or how is diabetes working in your life. People bring what they want to the table, but the whole idea is that Stanford, through their large body of research, has discovered that anybody with any type of chronic condition experiences what's called a symptom cycle. And there's about 10 different variations in the symptom cycle: pain, difficult emotions, lack of sleep, anxiety. And what happens is this cycle feeds itself. One leads to the other. And people have a difficult time with that in between doctor's appointments, and that's what leads them to go to emergency and having difficulty in thinking they're never going to get better, a lot of fear about that. So we help them find tools that help break the symptom cycle. Yeah, so realistically, we see our providers occasionally, but people with chronic conditions live with their symptoms every day. So things that it might just be reading or some form of relaxation, might be exercise, so many different variables, and that the program is designed to help people discover that for themselves, because we do an action plan. Every time we do a workshop, it ends with an action plan, and it's a measurable action plan. For instance, I want to lose weight. Well, that's a goal. That's a goal. But an action plan are the steps that lead up to that goal. Like, I want to start exercising more frequently, so I will walk 3 times next week, Monday, Wednesday, and Friday. So it's very measured. Yeah, so they come back the next week and they report. And they say whether that worked for them, and it teaches them how to self-manage. Maybe something got in the way. Maybe their husband was sick, or any number of variables that come at us in daily life. And so they learn to be able to manage, how can I still do this even though something else is happening.
And I love the fact that I'm a real big list maker.
Yeah.
And I like to check things off my list.
Oh, I love it.
I do, yeah, I love that. And so if I've got it on a list and I'm like, oh, no, I got to check that off.
Sure.
Otherwise, you know,
Yeah,
and then I imagine they get some peer support from
Yes.
the group.
Yes.
How long does the group meet for the pain?
It's
management?
6 weeks long.
Okay.
And each session is 2.5 hours, which sounds like a lot. However, it is a short-term thing. It's just 6 weeks, and you're
Yeah.
going to get a lot of information. It's like 6 weeks to a healthier life.
Good investment.
So, and we always have a break in between. We always have some good snacks and a time for socialization. And people make friends,
I would
long-term
imagine so.
friends.
I would imagine
Yeah.
so. I know I've been into some of the senior centers that they've been presented at,
Uh-huh.
and they're like, "Oh, we didn't want the class to end.
Right, yeah.
We wanted it to keep going."
Yeah. Well, and we're looking at ways to continue the program.
And maybe do an alumni class.
Yeah, we
I like that.
alumni, or we encourage them to continue with their group if they live in a like a senior community.
Right.
Yeah, but there are other programs that may be on the forefront. Say, Walk with Ease would be a perfect adjunct to
Yeah,
Matter of Balance for that to continue going. And Walk with Ease is designed as such so that we teach them how to do it. And say an activities director at a senior living residence, we can train them and they can continue.
See, and I like the fact that you can train somebody, a lay leader, to administer these programs.
Sure.
So do you often have, or have you had, some of the folks that come in and do the classes become a teacher?
Oh, definitely. Yeah, actually that's your
That's the
best
best.
pool. Yeah.
Definitely. I think
Yeah.
that would be fun. I know I can think of one lady right now, Penny, that's
Oh,
isn't
right.
her- yeah,
Yeah.
she's been doing it for years.
Yeah,
You know,
definitely.
all the
Yeah.
different programs that we're doing. So
I think that's your best thing, is to have someone in-house that can really give some encouragement to people to want to attend.
So give us, we're talking about what's the difference between, evidence-based. I think we got that, but, I'd like to go back to a class and really what is the difference with these workshops? Because when you hear workshop, you often think that you're going to go into a classroom, you're going to get a book, and you're going to be lectured to. So, kind of give me a little bit more about the structure, because I think that's what really makes the classes for everybody.
Well, it's not a lecture type of format in any of them. We introduce some material, but the material is designed so that they can discuss between each other, their experience or inexperience with something. Yeah, it's more of an introduction of material. The persons that lead, it's always beneficial for the person to also be experiencing a chronic condition or have a loved one or a friend that has a chronic condition as well, because they're affected also. Yeah, so we're all relatable to each other, and we don't stand up, except when we're writing on charts and things like that. We do a lot of fun things that are like games. We do brainstorming, where we just throw out ideas. In fact, we don't answer any questions or anything until after it's over, but we put up a question and as many ideas that come from the group as possible. Brainstorming, problem solving, ways to come to a solution by looking at all the variables in a problem. Action planning, they're game format.
Yeah, I like that. Problem solving is that there is an art to that. And if you can break that down in a list, then it makes it easier for you.
Well, it helps someone become a critical thinker, whether they know it or not. With a game, you're teaching them to become a critical thinker. Yeah, to their benefit.
So, and you don't necessarily give them in senior centers. I think you look at all kinds of venues, right?
Yeah.
I don't want folks to think, oh, I'd have to go to the senior center
No.
to go to one of the classes. That's not necessarily true.
No, faith-based communities. We've had great success at a couple of them locally. In fact, we're going into our second workshops at both of the places. And I found that Matter of Balance is the most attractive to the community. It really says something to them because many people are dealing with falls, or they know someone who's had a fall, or they have fear of falling. There's a lot of variables to that too. But that kind of opens the door, and once they get to know us, then they're they're more apt to want to go to the other workshops.
To move on to some, the pain or the chronic disease
And we've
management.
we've been at fitness clubs and
Nice.
just
So how would I find out about your programs?
well, Area Agency on Aging NACOG has a website, a Facebook page. You could call the toll-free number,
And what is that?
877-521-3500.
Someone else is saying it besides me. I swear
Yeah.
I have to make up a song for that someday and, you know, sing it to the camera. But it is important. They keep a calendar at the toll-free number, so all the women that answer the phone, because we do have all women right now, know when you're doing the workshops, when they start, or if one's coming up, if it's already started. So do you have to go to all 6 classes? How does
You
that
don't
work?
have to, but you get the most benefit, obviously. If you do 4 out of 6 for chronic pain and chronic disease, they say you get as almost as good a benefit. I believe it's 8 out of 10 for matter of balance. There's a structure to that too,
Yes.
a level
For
structure.
the evidence
Yeah.
base, you have to go so many
Right.
times. So there's the ability to miss one here and there, just if you have to,
Well,
something happens.
Life happens.
Life does
Appointments happen.
Yeah. So-
I do want to say something about finding out. NACOG has revamped their entire website, so now we have links within that website to go right to the current workshops.
And that makes it easier too.
yeah.
We just launched that, December 1st, I think.
Right. Yeah, and so that makes it easy for everybody. Maybe you're not an online user, so you call the
Then you can
number.
call the toll-free number. It doesn't cost anything, and find out when we're going to do that. Also, if you're interested in doing a class, I would think, it'd be good to take one first if you're interested in teaching.
Oh yeah. Yes.
And then you and Susan do classes to teach the lay leaders, correct?
Absolutely.
Yes. Yeah.
Yeah.
And how many do you do of those a year?
It
Just
depends
depends?
on demand.
Okay. Okay.
Yeah.
And is there a cost to that, the class?
Not for the coaches. No.
Okay.
No.
And what about for the persons that want to go to the class?
No,
so
there's
if I
no
call
charge
up, there's
because
no
it's
charge.
grant funded.
Okay.
Yeah, the materials, the snacks,
Snacks are
everything
important.
is a part of it. Yeah.
And I know because of your love of nutrition and
Sure.
Susan as well, that they're going to be healthy snacks.
Oh, absolutely. Yeah, and that's part of it too.
Yeah.
I mean, we can encourage by delivering,
You know.
just by putting it out
Yeah.
there. Yes.
Show by
And
example.
sometimes, I think in a nutritional capacity, it's good to have fun.
Yeah.
So it doesn't mean like eat several cookies. Have a couple of cookies and some fruit instead.
Yeah.
Yeah.
It's-
I mean, occasions are meant to be enjoyed by birthday cake. You've got to make room in your life for things of that nature.
Yeah, because if we deprive ourselves of everything, then we go, off the deep end.
Well, you said you're in that cycle of on a diet, off a diet.
Yeah, and that's not good
just,
for you.
Food can be fun.
Food can be
Yeah,
fun. Food
I
can be
like
healing.
I like to teach sometimes foods and all the time foods. We know what sometimes foods are.
Okay, yeah.
Yeah, their birthday cake, their ice cream, their cookies, their things
like
like that. Yeah, and then all the time foods are fruits, vegetables, whole grains, beans, lean protein. So the idea is that if you eat all the time foods most of the time, you can afford sometimes foods some of the time.
There you go. I
Yeah.
like that. It's a
All
good
right.
philosophy. We should do a little class for the staff.
Okay.
Yeah, I think that would
can
be
be done.
good. Because I think everybody's getting better because we try to, by example, try to bring in good food
Sure.
when we're doing that too. But every once in a while you go in the kitchen and there's a big box of donuts, and I'm like, please, I don't want to look at
Sometimes.
it.
Yeah.
It's a sometimes food. Then.
Sometimes,
Okay,
right.
it's a sometimes food.
But in a business situation, there's a lot of birthday cake around and a lot of donuts and things like that. So it can make it a little more
Go in my
difficult.
room
Yeah.
and close the door.
That's a solution.
So we talked about the matter of balance and the differences on the evidence-based. Is there anything else that I'm missing that we haven't covered? Because I know you said, I don't want to miss what I want to talk about today.
Yeah. No, I think we covered it pretty well. I'm trying to think. I went to the State of Arizona Falls Prevention Coalition meeting yesterday, which we have just created another chapter, Northern Arizona Falls Prevention Coalition, but we had a presenter there that was just great. And what they've found, we know that immobility is detrimental to a person, but oftentimes that happens in hospitals, even when there's doctor's orders that says this patient must get up, and most of the time there is if it's a safe thing to do. But they created an assessment tool
Okay.
to determine what equipment to use and how many people, whether this person can stand up on their own without assistance. But I think there's a great potential there to use it in our workshops. For instance, it's very, very simple and user-friendly. One of the ways you can assess a person's balance is, say in a hospital, we'll say in a hospital setting, but you can also do this like I can do it for you right
Okay.
now, is you're sitting there in your chair and I'm going to extend my hand and you're going to shake my hand. Now, any kind of imbalance will reveal itself just by that, by crossing the midline of the
Okay.
body. It forces the right and left, and that will reveal a balance.
Interesting.
A balance imbalance. Yeah.
I think I'm pretty balanced.
Yeah, so far so good.
Yeah.
And then the next one is just as simple. You would have them lift their leg and see how easy it is for them to point their toe and to flex. And that tells you
Okay.
the capacity of their upper leg strength. So quite simple to
Nice.
determine.
And it's
yeah.
really great that we're going to have a Northern Arizona coalition.
Oh, absolutely,
Because
yeah.
it brings together a lot of disciplines
Yes.
and different people that are working, because
Yes.
falls are a huge problem.
It's the third leading cause of injury and death for people over 60 in Arizona.
You know, and I
Yeah.
think that's, you know, when you hear that statistic, it's like, wait a minute, I didn't know it was that prevalent, and how much it costs.
And oh yes, I mean it's not just the person who falls; it's their caregiver, it's the healthcare system. And the thing about that, I would really like people to know, is it is preventable.
Yeah.
Whether you go to physical therapy, you start walking, even if you just walk around your dining room table a couple of times, just to gradually increase activity. Or a Matter of Balance workshop. And the thing that's great about a Matter of Balance is it focuses on not only exercise and physical activity, but your attitudes, your habits. Do you wear flip-flops when you're walking down a long flight of
See,
steps?
what did I say? It was about the shoes. So,
Yeah, that has a lot to do
so
with
there
it.
it is. It's about balancing. It's a matter of balance. It's about focusing on that and knowing that it's preventable. And you can call and ask for Beth Brehio, or you could just call the toll-free number and find out what the next class is. Thank you so much for joining us.
Thanks, Mary.
Appreciate it. See, it's a matter of balance. Thank you, Beth Brehio. Thank you for joining us today. This is Senior Moment.